Hey there, and welcome. Let's be honest, there's almost nothing more stressful for a horse owner than seeing your animal sick or injured. The goal here is to arm you with the knowledge you need to stay calm and act effectively when every second counts. If you find this stuff valuable, do us a huge favor and hit like, drop a comment, and subscribe to Veterinary News. It really helps us keep making content just like this. All right, let's get you prepared.
You know, this quote from the Merck Veterinary Manual just hits the nail on the head, doesn't it? It gets right to the heart of the matter. This isn't just a medical issue, it's an emotional crisis. Your horse is hurting, you're scared, and you know the clock is ticking.
But here's the thing, and it's a powerful truth. Being prepared turns all that fear and anxiety into focused, effective action. And that's exactly what we're going to do today. Build a clear plan that puts you back in the driver's seat.
So, here's our roadmap. We're going to start with the critical work you do before anything happens. Then we'll dive into spotting common emergencies and the first aid you can actually use. We'll also pull back the curtain on some advanced vet procedures, talk about the tricky business of transporting an injured horse, and wrap it all up with the key takeaways.
All right, let's jump into Section 1, Before an Emergency Strikes. This is all about building your safety net, because really, the best emergency response is one you've already planned out.
This isn't just some list to check off. This is your game plan. I mean, think about it. Have you actually talked with your vet about where you would go in a worst-case scenario? Are those phone numbers just in your phone, or are they posted somewhere obvious in the barn? Because you do not want to be scrolling through contacts or fumbling with Google Maps at 2 in the morning. These things, plus a well-stocked first aid kit, and just practicing calm handling are absolutely non-negotiable.
Okay, so you've done the prep work. Now, how do you know when it's time to spring into action? Knowing what to look for is the first, and I mean the most critical step to getting your horse the right help fast.
So picture this. You walk out to the barn, and you see your horse looking really distressed. He's coughing, there's drool, maybe even foamy feed coming out of his nose, and he keeps trying to swallow over and over. What is going on here? Well, this is a classic picture of a really common and, frankly, pretty terrifying emergency.
And this is exactly where knowing the signs is so important. The symptoms we just talked about, that's choke and esophageal obstruction. It's totally different from colic, where you're looking for signs of belly pain, like pawing the ground or rolling. A fracture is usually a sudden, can't put any weight on it lameness. And heat stroke has that big red flag of a horse that has just stopped sweating. Being able to tell these apart is how you give your vet the crystal clear, life-saving info they need when you call them.
So you've spotted the signs, you've made the call, the vet is on the way. Now what? Section 3 is all about what you can do in those crucial minutes while you're waiting.
Let's take a simple cut. Your number one job is super simple. Control the bleeding. Get a clean cloth and apply direct, firm pressure. That's it. Don't go crazy trying to clean it out. Just take a mental note of the details for your vet and cover it with a clean bandage to keep dirt out. This one simple action can make a massive difference in the outcome. Now, let's talk about a silent danger that lurks behind a lot of these problems, from colic to heat stroke, and that's dehydration. It's a huge concern that can make any emergency situation way more complicated.
And to give you an idea of the scale we're talking about, look at this number. A 1,000-pound horse that's just 5% dehydrated, which, by the way, isn't even considered severe, is already down 25 liters of fluid. That's more than 6.5 gallons. You can see right away why a bucket of water just isn't going to cut it, and why getting IV fluids from the vet is so incredibly important.
So the vet finally pulls up. What happens next? Section 4 is all about demystifying some of the common things they might do, just so you know what to expect and it's a little less scary. Okay, so if your horse has colic, there's a good chance you'll see your vet perform a nasogastric intubation. Now, it can look a little intense, but it is a vital, life-saving procedure. This tube lets the vet siphon off all that painful fluid building up in the stomach. It gives the horse immediate relief and can literally stop the stomach from rupturing. Plus, they can use it to give medication right where it needs to go.
Now, for a truly terrifying situation, where a horse just can't breathe because of a blockage, maybe from a snake bite or a bad allergic reaction, a tracheostomy is the answer. The vet basically creates a new temporary airway right into the trachea through the neck. It's a dramatic procedure for sure, but it's an absolute lifesaver when it's needed.
So what happens if the problem can't be fixed on the farm? Sometimes your horse needs to get to a clinic. And let me tell you, safely moving an injured 1,000-pound animal is a huge challenge all on its own. A successful trip starts way before you even turn the key.
The first, most important step is to stabilize the injury with your vet's help. After that, it's all about reducing stress. A low ramp makes loading so much easier. Trailer partitions are crucial. They give the horse something to lean on for balance. And hey, even something as simple as a hay net can do wonders to keep them calm on the road.
Now here's a pro tip that can make a world of difference, and it's all based on simple physics. In a standard straight-load trailer, which way does the horse face? Well, it depends on the injury. If it's a foreleg injury, you want them facing backward. Why? Because when you hit the brakes, their weight shifts onto their healthier hind legs. And for a hind leg injury, you guessed it, you do the opposite. Face them forward so their stronger front end takes the force. That one little decision can prevent a whole lot of extra pain.
We're on the home stretch. In our last section, we'll quickly touch on the very special needs of foals and then wrap up with the most important things to remember from all of this.
Foals, they're just so fragile, and things can go south in a hurry. So these are the numbers you need to have in your back pocket. After that first hour of life, a healthy foal's breathing should be around 30 to 40 breaths a minute, and its heart rate needs to stay above 60 beats a minute. If you see anything different, that's your cue to call the vet right away.
You know, after all is said and done, everything we've talked about really boils down to this one simple idea. All the checklists, all the knowledge, the first aid kits, those are your tools. But the single most effective tool in any emergency is you, a calm, prepared owner who can think clearly and act without panic. Your preparation truly is your horse's best defense.
So I'll leave you with this final and maybe most important question. Don't wait for a crisis to find out. Use what you've learned today and go take a look at your own setup. Is that kit fully stocked? Are the numbers on the wall? Is your plan truly ready for that moment you hope never, ever comes?
Thank you so much for watching. We really hope this explainer helps you feel more empowered and ready for anything. If you found it helpful and you want to support our work creating more of these practical guides, please consider buying us a coffee. The link for that is right down in the description. Stay safe out there.